Welcome to the American Institute of Healthcare Compliance. Our compliance tip today is understanding CLIA wave tests and appropriate use of Modifier QW. The content of this tip should not be considered as legal or consulting advice. Before we can talk about Modifier QW, we really do need to discuss CLIA and CLIA wave tests. Now, CLIA stands for the Clinical Laboratory Improvement Amendment. In total, CLIA covers about 260,000 laboratory entities, the Division of Clinical Laboratory Improvement and Quality within the Quality, Safety, and Oversight Group under the Centers for Clinical Standards and Quality has responsibility for implementing the CLIA program. The objective of CLIA is to ensure quality of laboratory testing. Now, the Centers for Medicare and Medicaid Services, or CMS, regulates all laboratory testing performed on humans in the United States through CLIA regulations. Your office or facility lab must be CLIA certified to receive Medicare or Medicaid payments. There are 7 criteria that are used to determine whether a lab test is moderate or high in complexity. Now, these 7 criteria are established under the CLIA regulations. Waived tests are considered simple and low risk. The modifier QW stands for CLIA wave test, and we're going to talk about what a CLIA wave test is and when we apply QW in just a moment. The CDC, or Centers for Disease Control, publishes a self-assessment checklist for good testing practices. Now, why am I covering that when we're talking about a coding and billing modifier, QW? Well, if your lab is not consistently producing reliable test results, and the payer finds out about that, so the patient comes to the doctor's office, has a lab test done. The doctor goes, boy, that lab test result just doesn't look right. I'm going to send you to the hospital and have the test repeated. Why should a payer pay for 2 lab tests when the first lab test should have been reliable? So it's not medically necessary, and it isn't fair to the healthcare payers to have to pay for something twice because your standards were not up to par. So do you have a CLIA certificate of waiver? And do you renew the certificate of waiver every 2 years? Do you perform only CLIA waived tests? Do you follow any additional testing requirements for your state? Do you follow Occupational Safety and Health Administration, or OSHA, safety regulations for occupational exposure to bloodborne pathogens? So what we're saying is that if you are certified and have your CLIA certificate and a certificate of waiver that you keep renewed, and you're doing things in a safe environment, then you should be reimbursed as long as the ordering of the test was medically necessary. Now, all of these rules apply. Why should we have all these rules for simple low-risk tests? Well, again, if it isn't performed correctly and there's erroneous results, then the test is not considered medically necessary, and also it can harm patients. Some wave tests have the potential for serious health impacts if it's performed incorrectly. For instance, results from a wave test can be used to adjust medication dosage, such as prothrombin testing, in patients undergoing anticoagulation therapy and glucose monitoring and diabetes, and it can result in a medication adjustment that could harm the patient. In addition, erroneous results from these types of diagnostic tests, such as for human immunodeficiency antibody, can have unintended consequences. To decrease the risk of erroneous results, the tests need to be performed correctly by trained personnel and in an environment where good laboratory practices are followed. Now, the modifier QW is used to identify waived tests and must be submitted in the first modifier field on the claim form. Now, CLIA tests that are waived requiring QW modifier are considered simplified analysis tests. CLIA laboratories and testing sites have to have one of the following certificates to legally perform clinical laboratory testing: certificate of waiver, certificate of registration, certificate of accreditation, certificate for physician-performed microscopy. Certain CLIA certificates that have been issued may limit the holder to perform only certain tests. These are certificate of waiver and certificate of physician-performed microscopy procedures. If a provider currently has one Medicare Part B provider number covering more than one clinical lab testing site, both sites are required to have a CLIA number. The provider should use the CLIA number that specifically represents the site where the tests are being performed. Now, all clinical laboratories must include their CLIA numbers on the claim to avoid an unprocessable rejection. And this is placed in item 23 on the 1500 claim form, or the electronic equivalent. This slide is a little decision table, and it talks about modifier QW. This is a nice little illustration to visually see the questions you need to ask and to help to create a checklist to ensure you're appropriately appending modifier QW to Medicare claim form. Is it a lab procedure? Well, no, then you're not going to bill it with a QW. Is this a CLIA wave test? If it's yes, then is modifier QW appended to the procedure on the CLIA waived test list? And if it says yes, then append QW modifier.
COVID-19 updates include the addition of the QW modifier to HCPCS codes U0002 and 87635. Medicare will permit the use of codes U0002 QW and 87635 QW for claims submitted by facilities with a valid current CLIA certificate of waiver with dates of service on or after March 20, 2020. Please reference CMS fact sheet MM11765 for more information. The direct link to this PDF fact sheet can be found in this video's description.
Visit our website, aihc-assn.org, or call us. We'd love to speak with you.